Yeah, I mean, I'll be honest, it was an EPR is, like I say, is a complex project, and it started off really well and then it didn't go so well, and it was
Sure.
very challenging. But what emphasized what the clinical ed team and myself had achieved was that we still had the buy-in from the organization. Clinically, they were with us. And I'm not gonna, lie, it was tough. And
Yeah. Yeah.
I've noticed that as Jenny's joined from Tees, and she was a major factor in the success. I'm hoping it's still working and going well. But I think basically we were very honest and transparent. And when it wasn't going so well, it was not down to the clinical work and the clinical design. It was more down to the capability of the system. And then you try to really work out what the impact's going to be, but there's nothing like a go live. So
Yeah.
one of the things that we did do was completely ongoing support. We had like a Teams calls that were open all the day, so people could join in and access. And created an AI bot, which had we
Okay.
loaded it with lots of information in. So if you were that way inclined, you can ask the AI bot, and it answered over like 12,000 questions. But there
Wow.
was there was a regular feedback mechanism, and the trust was very good at this. It established goal command and other commands, and it fed back to the teams that were having problems what the ongoing issues were, and it was very transparent. I think some of the things that we'd put in place, like the weekly clinical leadership thing, they stayed in place and they were involved. So a lot of the pre-work actually really benefited when we went to go live.
Yeah.
Um, some again, you still need that prioritization mechanism, but
Yeah.
rather than the project and the program team prioritizing, it's very much to the organization. What are the key concerns? What do we need to address? Obviously, above everything is clinical
Yeah.
safety. That drives those
Yes.
things. But again, to maintain the ongoing support, you've got to set your benefits early in the day, and it's about monitoring those, having some sort of KPIs and reporting outcomes that you feed back about how well we're doing, completion of notes or care plans signed off or whatever it is. It's that
Sure.
constant communication um, and maintaining that leadership. I think for an organization, the EPR project starts once it's gone live. For the program
Mm.
team, it's been full. But for the organization,
Yeah.
once we go live, that's the first time they get their
The
hands on it.
beginning.
That's
Yeah.
when things you may not have thought about come up, and then it's maintaining, I guess, for at least for a while, that project sort of mindset, that regular prioritization, having meetings, discussing key things, and being very transparent with the communication and feedback about what is being done to address concerns or any problems and issues.